All right. Welcome, folks, to the part two of Train the Trainer, the session on feedback to impact, elevating FCS programs by assessing satisfaction of people engaged in services. So happy to have you here today. Today's session is going to be a continuation of how we are really amplifying the voices of individuals, service participants in FCS programs to help them contribute to the process of quality improvement, to bolster um, better services, more effective services, services that are aligned with the end user's needs and preferences. And so we're going to continue walking through from session one, information pertaining to best practices in developing surveys and putting some of that information into play today, putting it into practice. Just as a gentle reminder, today's webinar is hosted by DBHR through the Washington State Healthcare Authority. We are so grateful to our funders for really supporting this series and other series within the Rutgers Washington State Collaborative Learning Communities. Our session today is hopefully going to be very interactive. We encourage you to ask questions, participate throughout the session using the chat feature, unmuting, whatever feels good and right for you. And as a gentle reminder, the slides will be, as well as the recording and other materials, provided in the email. Housekeeping basics, just remember to keep those cameras on and microphones muted. Use that text box, and you can unmute, during activities, because it's, again, a small group, and we could certainly have some good dialogue today. Thinking about our artificial intelligence statement, we just want to be reminding folks that automated note-taking bots, similar tools during any of the Washington State FCS events, really requires prior authorization or approval. So if we see any unauthorized use of those tools, unfortunately, we have to remove them from our session to be mindful of privacy and confidentiality. And let's get to the nitty-gritty. Today is a continuation of part one, where we were learning about best practices for satisfaction survey development. We are now going to dip into a bit of implementation science, looking specifically at Enola Proctor's model of implementation science, and give you some good, clear definitions of what that is and how you can leverage it in building out your own satisfaction surveys or when you're training. We're going to look at strategies for data collection, analysis, and feedback loops. Earl is going to dive into what that process could look like and how you could support your process and training to those specifics. And then we're going to hopefully, just as we've been throughout the series, applying the concepts to your programs, your needs, what you're seeing, on the ground. So a gentle reminder, a review, why satisfaction surveys matter. We know that the key piece of what we're doing, right, what drives our work, whether in supported employment, supportive housing, is to help a person with their wellness and recovery goals globally, but also in these very specific domains of housing and work. And when we get information from those individuals, when we engage, collaborate, have dialogue with the end user to service participants, we have a unique opportunity to look at what's working, what are we doing well, and where are the areas for growth, right? Where are those gaps? Gaps in services, gaps in policies, procedures, how things are done, right? Informal and formal. And so satisfaction surveys really give us this opportunity to develop a better quality of service, to hone what we do to support individuals in housing and employment programs. And we went over, and I'm going to put it into the chat again, our checklist for developing satisfaction surveys. That was in our workbook. And in that workbook, I believe it's, I want to say on page 11, you have the checklist for best practices. And you should be able to open that document in the chat now. That was provided for session 1. And so we're pulling from that workbook again to do a brief activity. And so we are looking at, I'm going to put it into the chat, the final activity in our Google Doc. In that Google Doc is a copy of the worksheet for developing survey questions based on the best practices checklist. And so when you open that Google Doc, you'll see the worksheets that we previously completed for part 1. And then on, I believe it's page 4, this new activity where Earl and I are going to put you into the breakout group rooms. You guys will do the activity together and you'll be able to look at questions. We'll do 1 through 5. We don't want to take up too much of the time. So in your breakout group room, collaborate with each other on questions 1 through 5 of that Google Doc, page 4. You're seeing sample survey questions, and you're going to, using the checklist from last session and the checklist that's in our workbook, the Train the Trainer workbook, you'll be able to get information on what are those best practices and do those sample questions adhere, why or why not. And if the question doesn't adhere to the best practices, then just take the time to reword it. We'll give about 5 minutes, 5 to 6 minutes for you guys to chat about 1 through 5, and then we'll come back and talk a bit about it. Sound like a plan? Any questions? Any questions on what we are doing with the activity? Okay. I will see you guys back in about 5 to 7 minutes. I see Jennifer. Jennifer, do you need help joining the breakout group room? Okay, Jennifer is in.
Jennifer's gone.
We could get, right, question 1, how much can we really learn? It's very general, very vague. And so when we think about rewriting question 1, what did you guys come up with? Anything specific? Based on best practices, how could we hone that question to be in line with best practices?
So we had come up with a couple, which I'm not sure if they really like narrowed it down, but I felt like it was worded a little bit better so that it wasn't a yes no question and it wasn't like leading.
Perfect.
Yeah, so we had come up with, what is your overall satisfaction of the program and how was your experience with the program, and just thinking about using one of those Likert scales.
Amazing. So you have a neutral statement for your Likert scale, where you can quantify a degree of agreement or disagreement or frequency, right? And then you're able to, based on that closed-ended question, that statement or phrase, with the Likert scale, get some good information about degree of experience. Amazing. I think you guys did a great job with that. So This is a great example of how you can go through your program and organization satisfaction surveys to check for clarity, to check for if it's meeting those best practice standards, right? Using the checklist to go line by line and seeing if it's congruent, right? Is it clear? Is it double barreled? Right, let's measure one thing, right? Question two is that double-barreled question. We have the job developer and housing specialist lumped in together. So we would want to go through our satisfaction surveys and get a sense of where we're at. And I encourage you to reflect back in the toolkit, the workbook, to look at that practice and those checklists. So building off of best practices, we're dipping now into implementation science. When we think about implementation science and looking at services and satisfaction surveys through this lens, we're identifying that the scientific study, right? Implementation science is the scientific study of methods to promote the systematic uptake of research findings and other evidence-based practices into routine practice, right? And so it's not just to improving the quality of service, but the effectiveness of our services. And when we think about specific implementation science approaches, we are starting with this piece of Proctor. Proctor really looked at developing a taxonomy of their implementation science approach. There are several factors associated with Proctor's implementation science approach. Again, it's this piece of what is the quality of services provided? What is the person's perception of the services provided? And what's the fidelity of those services provided? And we really emphasize, Earl and I, in our work at these pieces of Proctor's model. For you guys to kind of familiarize yourself with. So in thinking about how you develop your surveys, in addition to those best practices, we want to frame questions to look at this piece of acceptability. How satisfied is the person with the service? Appropriateness comes down to, does that person feel like the service meets their need? Is it matching the need that they have? Feasibility is how practical, how accessible is the service for that participant to access? And then the fidelity, right? How well does the service follow the intended model? And in our case with FCS, supported employment and supported housing. And so as we continue thinking about our piece of implementation science, we can see in our workbook on page it starts right at page 12. The definition of implementation science was what we just reviewed, objectives for using implementation science, and then key definitions that we highlighted in the PowerPoint. So you can refer back to these pieces as, again, you're assessing your surveys. Does the survey, next slide, please, Earl, ask questions about not just satisfaction, but appropriateness, right? Not just that accessibility piece of how satisfied, but the appropriateness. Does your housing support your recovery goals? Does your housing services assist you in those recovery goals? Or that feasibility? Is it easy to use your services as needed?
Excuse me.
Oh, bless you. So we also have an accompanying implementation science workbook that you guys could take a look at if that's something that interests you to learn more about this. But really, when we think about survey design, when we couple that implementation science with those basic standards, it really gives us some good best practices, evidence-based approaches for survey development. And Earl is going to further explain some of those pieces as we continue for today.
Thank you, Amy. Glad to be with you as usual in Washington, folks. wanted to follow up, certainly, piggyback on Amy's kind of framework and conceptualization of not just the development of surveys as an instrument of getting a sense as to people's participant satisfaction with the service and how their feedback informs um, changes and responses as to how the service is modified to better meet the
Recording.
needs of the consumers, but as well as really looking at the science behind it, the concepts and the principles and the guidelines and the evidence-based practice that supports approaches that gave some kind of a framework to how to ensure that we're doing this in an effective way, that our responses are not simply just responses, but they're accurate, right? They are a reflection of us hearing, understanding, and therefore ensuring that we're responsive to our participants' concept and belief as to how the services are impacting them and what they see potentially as necessary changes to further enhance that collaborative relationship and that sense of gaining the outcomes intended, ensuring that we are aligned with the fidelity of the model and the practice that we utilize in the provision of services. So it's an ongoing concept, but I think the latter part of this afternoon, we're going to really spend on looking at how do we integrate the science in our implementation practices, and how do we gauge and measure whether or not the manner in which we're soliciting or eliciting feedback is really designed in a way that help us make the best responses and make the necessary changes and ensure that the services are consistently fluid and evolving with circumstances and changes to our participants' life and the circumstances existing. So we want to connect outcomes to the survey questions, right? It's important with the Proctor model that we have specific elements that we need to ensure that the questions we're asking, what we're seeking, really speaks to specific categories of outcomes that ensure that we're being not just responsive, like I said, but accurately in that manner. So when we speak to acceptability, which is one of practice outcomes, we want to ensure that the question reflects that, right? And there are certainly many question examples, but I think there are some that are more aligned and more concrete in a sense. So when we talk about acceptability, an example of a question is, how satisfied are you with your job coach? And what that lends itself to is both a very direct, kind of specific question, but it still allows for really a reflective kind of feedback, right? Um, so it doesn't give the concept, it's both a good scope, but at the same time, it ensures that you get a response that is meaningful, that you can actually act upon. We look at some other options as well, some other outcomes element. We look at appropriateness. Does your housing support your recovery goals? Now, it is important to recognize that sometimes it may appear as though these questions could just be a yes or no response. But how we formulate these questions could really determine whether or not we get a full or robust response. And it's important to ensure that the questions are formulated and designed as such. That's why we spend so much time in that kind of practice element, to ensure that we're looking at questions with an intuitive eye as well as a critical eye, and ensuring that those questions line up in a manner which it would give us kind of the best responses. Any questions there in terms of seeing the connection between the outcomes that we're trying to address and the questions and how they connect? Does that give you further insight? Does that make sense? Can you see the connection? Absolutely. Okay. Very well. So we want to kind of look at another reminder, really look back and take a scope of kind of foundational stuff that we're looking at. You know, what are some of the best practice elements? I know you've talked about that a lot in part one, but We want to ensure that the language we're using in the formulation of those survey questions are really trauma informed. And the question is why do we need that? Why is that important? And I don't want to just simply spot on that. I want to get a sense from you as to why you think it's important to really be trauma informed in the design and development of questions to get the kind of responses that would best inform our scope of understanding as to what needs to be changed or what needs to be enhanced or what in some instances continue to be just as good as it is. Why is it important to use trauma-informed language in survey questions? And remember, you don't have to focus on the perfect answer, right? You just have to focus on the answer that speaks to what you're processing, because we're here to co-learn and learn from each other. So don't be afraid if there's no wrong or right answer.
I mean, it seems to me it makes the survey more accessible so that it's equally useful for people who need the trauma-informed language as well as the people who don't.
And Lenny, you're spot on. You know, in our field, we would say everyone needs trauma-informed language, right? We don't consider, yeah, we just assume that everyone will be best supported by language that really speaks to the idea that people are coming into our service because they've had things happen to them or around them or because of this, you know. So there's always that concept that there is something that people are potentially vulnerable to. And therefore, we have to be the gatekeepers. We have to ensure that the manner in which we communicate with folks is always thoughtful and reflective of that likelihood, if that makes sense. But it's just as important that in asking the questions to gain information from folk to inform how the service impacts them, we want to make sure that we're not re-traumatizing folks, right? We're not asking them blunted questions or questions that really negatively impact their sense of wellness. Because it's very difficult to ask people to help me help you while you're hurting them. Right? Whether consciously or not. So the most important thing is you want to make sure that people feel safe and at ease and be able to create an environment, a welcoming environment enough for them to give you an honest response and feedback that really informs your continued effort to improve quality of services. You want to make sure you're time sensitive because, as we know, time is a value, right? And our participants, as much as we may, in some instances, think they have a wanted amount of time, really responding to the questions, Q&A kind of approach is most of us, we only have a certain level of tolerance, right? A certain level of scope that we can engage in to really provide meaningful response. Because after a while, it can slip away. So we want to limit that stuff to 5 to 10 items because both the research and the practical approaches, you want to make sure that people can focus their primary thoughts and elements on those quintessential questions that really lends itself to some kind of information about how they've relating to the services and how they see the potential for quality to be improved, enhanced, or remain the same in that sense. So limiting it to really prudent, significant, questions that are really appropriate to the areas that matter to them is just as important as the kind of questions you ask. How much is just as significant as to how well you ask the question. Because if you ask me 20 very good questions, and I think a good example is the time frame we give you guys to do the practice, and what we learned from that is that as much as we think that may have been an adequate time, we had to account for technical difficulties. We couldn't plan that in advance. So these are some of the things that are important to recognize in terms of best practice. You want to also use multiple collection modes, and there's a reason for that, right? Using multiple collection modes or modalities really help to meet the needs of a wide variety or expanse of people, because people sometimes are responsive to things very differently. I'm one of those people who send me a survey that I can read, hard copy, I can write, I can use a pencil. That's just me, old school. Some folks, it may be a lot easier for you to have virtual on an app. They can, do it while they're on the bus or do it while they're staff. So it really lends itself to meeting the learning and the response approach that are just as diverse as the people who we're seeking information from. You want to make sure you're adapting those questions to different cultural contexts. Because it's essential for obtaining accurate and meaningful data across different culture, while you're being respectful to cultural diversity and adapting methods accordingly. Can anyone think of an example where being culturally responsive resulted in a better feedback or outcome, and what kind of approach was used to get that more meaningful response from someone? Can you think of a specific example where it was so important or critical to take a culturally specific approach or a culturally responsive approach to gain feedback from that person? All right, I'll contribute. I'll give an example. Classic example is there's some cultures where looking people directly in the eye is considered an insult. It's considered, an aggressive or an authoritative way of doing things. The likelihood is if you're engaging that person in a one-on-one interview, you have to be aware of that, and it may be better suited for that person to not necessarily ignore their gaze, but lower your gaze. All right, you're not looking them directly in the eye, making it feel like an interrogation. But your awareness that that's important to that person, that's a tangible way in which that culture operates, can lend itself to that person being more at ease and more willing to engage with you in a meaningful way, because there is a mutual understanding that you are aware and respectful of that person's culture. And as we know, culture is more than just different nationality or religion. We talk about people at different age levels. Things may be very different. People with certain capacity, I think if someone has a visual impairment, you don't want to, do something that is only on a screen in a faraway place that they can't observe clearly. Similarly with other impairments, you want to be responsive to that. And ultimately, we want to ensure that this anonymity is afforded folks for many reasons, particularly the fact that people want to know that their information may lend itself to a response that is both germane to them particularly, but as well as to the general cohort of participants, as well as not everyone is readily confident or ready to share stuff and it be associated with them specifically, right? Particularly difficult information. If, and a classic example, if someone feels that their particular supported housing staff is not respectful to them, simply in the manner in which they deem respect, and you ask a survey question, is your supported housing staff respectful? People may be a little coy or a little cautious about sharing that information, unless they know that it's not going to be directly associated with them. But they know the importance of sharing that information to ensure that the change is activated so that their experience in the service is better. Does that ring a bell? Bravo. So we want to kind of skip along rapidly. We're moving time is going. So we look at data collection methods, and I want to make sure, like I said, we're looking at the how and the best practices and how they align with the evidence-based modality of doing this. So in terms of data collection, we want to ensure that we're doing it within the scope of how we provide services. And some of the best times to really get information from folks is at intake or exit, right? On either end of the service experience. Ultimately, though, there's no one size fit all, right? Your method should reflect your population's need. So if you know that a tremendous amount of people leave your services in many regards without, that's a classic example. If this service has a mandatory end time and termination time, right? Not everyone is likely to leave in good spirits. So doing your survey at the end of it at discharge time may not be the most prudent time to do it if that service has a mandatory cutoff time. For those folks, it may be better had sometimes at the intake as opposed to the exit. So that's one kind of point of reference that you need to be conscientious of. We also want to look at the approaches, the kind of collection methods that by researchers lend itself to more meaningful and tangible feedback. And one that is oftentimes not prominently discussed is those periodic pulse surveys. Are any of you familiar with the periodic pulse survey? And it's kind of funny because the name speaks to it to itself, literally. It's really just periodic surveys that are short, frequent, and they're used to gather kind of real-time feedback from participants. So it's really those quick check-ins, as opposed to waiting until the annual survey. We want to kind of make sure it's fluid, it's ongoing, particularly if things are happening in the environment that is drastically changing the tenor of the environment. We want to make sure we're taking the pulse. Literally, it's like taking the pulse of our participants ongoingly. And they tend to lend itself to good information that we can use both in responding to needs, or we can use to kind of measure against the long-time annual kind of reports or surveys. So sometimes we can see, you know, 2 times prior to the end of the year, people have had a good sense of feeling about their experience with the service. And then at the end of the year, typically it may be a more challenging time or vice versa. So we want to kind of have that as a point of reference. We want to also potentially look at focus groups, because it's not simply sending a survey and having someone fill out the survey is the only methodology or approach that works. Focus group work, sometimes that's the best kind of approach. People feel a little more confident and safe in a group. Or they may use that group to have that group cue in their responses, as opposed to someone sitting there and having to think, I have to come up with all the answers. Sometimes when someone else in that group that you're inquiring with raise a subject, like, yeah, now that you say that, I think about it in this way. I think about my experience in that way. So sometimes a focus group really lends itself to more confident and collaborative kind of responses. There's also, like anything else, a caution about focus groups, right? You get a focus group and you have a person who's very dominant and predominant in a group. It can also take away from those people who are less assertive. And before you know it, you have a kind of a theme where that prominent person is taking more of the scope of the responses. So you have to be cautious about that as well. Obviously, we have the advisory boards or interviews that really allow information to come from a kind of different stratosphere, kind of in a macro level, but it's important for us to get feedback from all levels of it, service engagement and stakeholders in the theme as well. How do we maximize response rates? Because typically the best created surveys or the best created approaches that doesn't really maximize, doesn't have a maximum response rate can fall short of the expectation. We want to ensure that potentially we're using trusted staff that people are more responsive to, particularly if we're doing one-on-one interviews or handing out surveys. We want to ensure that we're providing that kind of safety and that kind of familiarity. We want to choose a calming time and not during a crisis, right? We want to wait until there's, for example, the worst time to do a survey is when the programs are, losing funding and people are, services have to be reduced. It's not time to do a survey about satisfaction. So you want to be conscientious of that. And you also want to ensure that it's a time that people are at ease. You have someone who's going to a day program, a partial program, and, the minute they walk in the door is when you come to do a survey. It's probably not the best time. Tired, exhausted, had enough for the day, probably not the best time. The best way to do that is really discuss with the folks what's the most optimal time that you can focus, you can really provide the most comprehensive responses, and you garner that from that person by simply asking when. It's important to explain the purpose of the survey. As we typically would say in our training with the golden thread in FCS, people tend to, if it's not important to them, they can't see the value and the importance of it. There's not a whole lot of energy and effort put into it. So it has to have a purpose that is meaningful to the participants or the responder, so that they can take the time and prioritize it. So we have to ensure that we are sending a message very clear. What's the purpose of this survey? This survey is intended to get feedback from your participants that informs our current practices and our future practices. So we're seeking to determine whether or not the level of satisfaction that people are currently reporting are in alignment with what our expectations and outcomes are for the program. And if not, so we need to make the necessary changes to ensure that we're enhancing that outcome. Send reminders strategically. Lots of folks, most of us, we start something and then something gets distracted. We forget it. It's not that important. We need to know that there's a priority time for it, right? Please be reminded. Thank you for, giving us feedback that you've kind of done the first quarter, but it is important to have the survey completed. And, you have until Friday. Let us know. We'll check in with you again on Wednesday to kind of ensure, see if there's any challenges or obstacles that are preventing you from providing complete survey. Offer small incentives when appropriate. We've had evidence to show that happens. It can't be the only source of motivation for people to do the survey, but it helps. It lends itself to some positive stuff. And I'm thinking of what's the most popular coffee shop in your neck of the woods in Washington. Here we have, give me a Wawa, $5 Wawa card, and I will do any survey for you, right? But I think they may have a specific one in Washington that works, whether it's Dunkin' Donuts or a specific coffee shop, something of that sort. But it's important that you're incentivizing people's effort to provide information. You're not influencing their responses. Very important distinction to make. Key metrics that we must monitor: overall satisfaction, respect, dignity, and cultural relevance, responsiveness and accessibility, and open-ended themes. We want to see the themes, right? If people are saying, people in supported employment, we've got some great responses. People are saying, listen, we're finding jobs, we're feeling that people value our recovery, people see us as capable, people see us as competent enough and capable enough, and people understand the relationship between work and a sense of value and well-being. We want to make sure that we're getting those metrics, right? We want to see the themes. We want to see what's occurring, what's the kind of response, where it's angling to, what are the trends, those elements we're looking for. Building that feedback loop at the end of the day, even if you provide the best inquiry in terms of your surveys or other approaches to getting data, if that information is not being appropriately analyzed and then provided some feedback and responses to the stakeholders and the participants, you're really doing a disservice to the people who are taking the time and energy to provide you with feedback. So we want to make sure we go from collecting to analyzing that data, sharing it, and then acting on the feedback and the value that we get from it, and ensuring that we're continuously reassessing where things are. So it's important that the feedback loop is complete, and we're not just collecting this data and putting it on a shelf somewhere until later date. but people have a clear sense that once they complete this data, they understand what's going to happen to it and how it's going to impact their role and responsibility in the whole circle of ensuring that their outcomes are met. People want to know, when I give you this feedback, what are you doing with it and how it's going to impact my sense of or my experience with this service. They need to have that loop. And there's some great examples and information of infographics about the specific feedback loop. I just gave my version of it. I like colors and I like to see the balls moving around, but there's many ways in which it's reflected. But it's a really good concrete way of looking at how that information is utilized to ensure that the stakeholders, particularly participants, are being responded to based on their feedback they're providing to you. It creates a culture of trust and responsiveness. If I know I give you this information, this critical information that took me a while to give to you, I had to really get my confidence up and I had to make sure that I feel safe and that you're not using this information negatively against me. I want to see where it's going and I want to see how is it doing anything positive for me? How is it changing my experience in this service? How is it doing so for anyone who comes into this service, even after I am gone or after I have graduated from this service? I want anyone who follows me to have a positive experience. And sometimes that positive experience is based on what I lend in terms of feedback to the providers. So there's lots of activities in that step. We need to analyze the data. We do so from a quantitative and a qualitative concept. We look at the level of satisfaction ratings, like are people very satisfied? What percentage of people feel positive about it? We want to compare that across locations, demographics, and service types. So we want to have a really good comprehensive view of it. Not just the sense that people are satisfied, but who's satisfied, particularly what and why is that meaningful in terms of people in Tacoma more satisfied with this particular service as opposed to people in Spokane. We want to make sure that we're looking at those elements. The qualitative element of it, we want to ensure that there are themes. If people are feeling, for example, people talk about respect and in some instances where the services or service providers are hard to reach, we want to ensure that we're taking those elements into consideration as well to address those concerns and needs. And we use a number of codes to ensure that we're getting that information, deciphering that information from the general information. So we can look at it from a theme analysis, kind of content analysis or deductive stuff. We want to ensure that we're getting those messages within the messages, right? How do we take that feedback and put them into categories to ensure that we're making sense of the information? We want to ensure that we analyze it across, like we said, demographics, location, and so forth. We want to ensure we're looking for trends. We want to ensure we're combining both qualitative and quantitative insights. There's some practice element for interpreting samples, and I want you to take a look at it. A lot of this is really references. A lot of it you can actually use, come back to and use as the point of reference to kind of ensure that the people you're training has some good practice. So a lot of this information is something you can come back to or use in your particular element to train and teach the people who are going to do the direct kind of collection of data. Connecting the feedback to FCS goals.
We are at time, Earl.
We are at time. Okay, fair enough. So a lot of the information, and I want to make sure that we have that, really speaks to the how. We want to show how we connect all the stuff and how the data is really interpreted, responded to connect that loop, to ensure that that loop is tight and it's in that manner. So I want to thank you all for your valued time in engaging with us. We hope that the information provided was both meaningful, tangible, and has some utility. And you can, like I said, use it as a point of reference to come back to train the folks that are engaged in collecting data. And we hope that it really lends to some really positive quality assurance and continuous quality improvement strategies and approaches.
I put the satisfaction survey in the chat, so please feel free to click on that. Thank you guys so much for attending.